living with GvHD and a compromised immune system, it really is like being on a continual roller coaster ride that has both expected and unexpected twists and turns.
Hello, and welcome back to a brand new season of the Blood Cancer Experience. I'm your host, Christina Clark. Today, we're focusing on a condition that affects many people who have undergone a stem cell transplant: graft versus host disease, otherwise known as GvHD. GvHD is an unfortunate side effect of a life-saving procedure. It occurs when the stem cell donor's immune cells, the graft, attack the recipient's body, the host. This complex condition can impact various organs and systems, creating significant physical challenges for people navigating life after blood cancer. We'll explore what it's like to live with chronic GvHD through the personal story of Libby Goszer, a long-term survivor of leukemia. And from time to time, we'll also hear from Dr. Kirk Schultz, a hematologist-oncologist who primarily focuses on stem cell transplantation. His research focuses on chronic graft versus host disease, and he's here to help us understand the medical intricacies of GvHD, from the different types to common symptoms and treatment. Libby's experience living with blood cancer began in June 2007, when she was living a busy life as a clinical psychologist and a mother to an 11-year-old son. With a single diagnosis, everything changed. Within 3 weeks, her world went from living a fulfilling life as a professional mother and wife to being diagnosed with acute myeloid leukemia, followed by immediate hospitalization and chemotherapy.
Yes, it all was quite sudden. Really, a mere 3 weeks after I started having these odd muscle spasms in my back, and I had this increasing neck pain and quite severe headaches. And within 3 weeks of those symptoms starting, I was diagnosed with leukemia, and it was just all so shocking. Because I had acute myeloid leukemia, which is an acute and aggressive form of leukemia, I was in a hospital isolation room within 48 hours of diagnosis. So, I left a half-written report on my desk at work. Being in hospital in isolation really would be my home for most of the next 4 months. I was, as you might imagine, I was stunned. I was physically very uncomfortable, and I was terrified of dying. So it seemed like overnight I went from a world that made sense into trying to figure out what was happening, and it was scary.
While Libby's initial treatment brought hope, the fear of relapse was always present.
I don't think I ever was in a position of making a decision to have or not have a stem cell transplant, though I obviously could have refused. Initially, after 3 rounds of chemotherapy, my leukemia was in remission. My medical team recommended that I try and see if I could maintain a state of remission without having a stem cell transplant. I did know that there was a chance that the leukemia would return, but that's what we did. But just 10 months later, my leukemia came back. At that point, my only hope for surviving was to have a stem cell transplant, so it didn't really seem like a choice for me.
And so what was that process like for you? Because certainly it's a scary prospect to undergo a stem cell transplant.
Certainly just going back into hospital and knowing that I was going to have more aggressive chemotherapy was very unsettling. At the same time, though, knowing that there was an anonymous stem cell donor who was described as a perfect match for me meant that there was at least hope that I might survive, right? And so it was sort of a combination of oh no, here we go again. And yet, oh, there's hope. There's hope. And so there was hope that I might survive, hope that my son would not lose his mother, hope that my husband would not lose his wife. So, I sort of embraced it as much as I could.
For Libby, as for many other people living with blood cancer, a stem cell transplant meant a chance at survival, but it also involved the risk of developing graft versus host disease, or GvHD. As Dr. Schultz explains, GvHD is a common side effect, but there are different types that vary in severity and duration. For listeners who might be unfamiliar, what exactly is GvHD, and why is it a common side effect of donor stem cell transplants?
Graft versus host disease. So graft is the cells being given from the donor. Host is the person's body that's receiving the transplant. And what happens is it's the immune system saying, this is not me, this is not self, and it begins to attack it because that's what the job of the immune system is to do. It's mainly developed to help protect us from infections. There's two forms. There's the acute form of graft versus host disease, which happens usually within the first 2 to 3 months. And it's very targeted, it's very specific. It only affects the skin, the liver, and the intestinal tract. And when I say intestinal tract, it can cause crampy abdominal pain and diarrhea, even blood in the diarrhea. And that one is usually diagnosed and found in the immediate follow-up that you'll see with your doctors at the transplant center. The chronic graft versus host disease usually starts around 80 days to 3 months after the transplant. And it is a slow onset of an immune rejection, and it can affect actually any organ system in the body. And the most common are the skin, the joints or tendons, what we call fasciitis. The lungs is the most severe. Chronic graft versus host disease particularly will attack almost any organ in the body and cause chronic disease. So a lot of the focus is on, what's going to happen to me in the next few weeks? How can I get cured? What are my chances of a cure? And even though we'll talk about chronic GvHD, it's hard to hear it as a patient or as a family member.
After the initial relief of the stem cell transplant success, Libby began to develop a series of unexpected and concerning symptoms. This signaled the onset of GvHD, marking a crucial phase in her post-transplant experience, where managing GvHD became essential to her recovery. Were you warned about GvHD as a potential risk when you underwent the transplant?
I was warned about many different outcomes, things that could happen in terms of having a transplant. But really, was it on my radar? Was it a particular concern? I will say no, because my priority was trying to survive. And a stem cell transplant was my only hope for survival. So that was my priority, not what some side effects might be of a life-saving transplant.
What were some of your first signs or symptoms of GvHD? How did you initially realize something might be wrong?
I remember while I was still in hospital, I developed quite a severe body rash. That was absolutely GvHD. It eventually resolved. For me personally, though, symptoms of GvHD that have been pretty consistent and stayed with me all of these almost 16 years have been primarily it's almost like muscle atrophy and weakness in my upper legs in particular. So I do have some mobility issues because of that. Dry mouth, oral sensitivity. So there are certain foods that I can no longer eat. However, I can eat most foods, so it's not really a problem. I do have some mild liver involvement and sort of features of autoimmune disease. So I have fatigue and I have poor stamina. And that has been fairly consistent over all of these years.
Would I be able to notice that you have mobility issues if I were to watch you walk in the street?
Depends what I'm doing. So if I'm walking just on a level plane, you would not notice. I look like I don't have any mobility issues. However, the minute I encounter steps, that's where you'll see it, because it's my quadricep muscles. So it's a little bit like I can't squat and I can't get myself up because those muscles, it's kind of like they're broken. So if I'm encountering steps, I need rails, or I need walking sticks, or I need a hand on one side, any kind of incline, that's when you'll see that, oh, she's walking strangely. So that's really more how it manifests.
Looking back over the past 16 years of managing GvHD, have certain treatment strategies worked better for you than others? Is there anything you found particularly helpful?
There's the obvious, when you have GvHD, it's important to be monitored closely by a medical professional, right? Because, again, I'm not a medical doctor, but I know that certainly immunosuppressants have been very important in helping keep my GvHD at bay all of these many years. But personally, I think the most important management strategy I've learned over all this time is to listen to my body. So before I had leukemia, before I had a transplant and GvHD, if, for example, I was feeling a little bit tired, I might say, push through it, get active, go outside, go for a walk, you'll feel better. And I might have, right? But now that strategy is extremely unhelpful. If I am feeling tired, I need to really respect that feeling of weariness and give myself as much time as I need to recover. If I don't, I simply prolong the feeling of fatigue and I may get more unwell. So that's an example of lessons that I've learned.
Did you see any medical specialists for GvHD, and what was the recommended treatment in terms of medication, if any?
Well, the only, I guess, medical specialist that I've seen would be my hematologist. And as I say, I've been on an array of medications, notably immunosuppressants for helping to control the GvHD, but others as well. So a related management strategy for me, unfortunately, has been that after almost 2 decades of being on medications, my kidney function has started to be increasingly impaired. So now I follow a kidney-friendly diet in an effort to maintain my kidney function. So that's sort of an additional management strategy. I do find for myself that doing things like going for physiotherapy when I need it, I go for regular chiropractic care, I enjoy the occasional therapeutic massage, which I find very helpful. And I do Pilates as a form of exercise on a reformer machine because it supports me and I'm able to keep myself as flexible as possible. I can't undo the muscle atrophy, but I can strengthen my other muscle groups. And I think that really has been helpful. So that's kind of what it looks like.
To help us better understand more about what Libby and countless others in her situation have experienced, Dr. Schultz will guide us through the intricacies of GvHD, how it's managed, and what the latest advancements mean for those affected. What are some early signs or symptoms of GvHD that people should be mindful of after a stem cell transplant?
Yeah, so the acute GvHD usually occurs in 2 or 3 weeks, and it's usually the person still in hospital. And it's quite dramatic usually because a rash comes on quickly or they get really crampy abdominal pain and diarrhea. So that one is pretty easy. Hey, something's not right. The chronic form comes on much slower and can happen up to 1 to 2 years after the transplant. And I've even seen some patients who are doing just fine, and then it comes on a lot later. So the problem comes into is if things that you were able to do or doing well, all of a sudden you feel like you can't move your joints as well as you could before, or that your skin doesn't feel normal, or your mouth is drier, or your eyes are drier. These are some of the common things that can be caused by chronic GvHD. For women, it can actually cause dryness and restriction in the vaginal area and lead to a painful intercourse. So it can affect almost anything. And so if somebody has something that doesn't seem right, they should just talk to their doctors about that because it sneaks up on people. A medical term we use is indolent, meaning that it comes on slowly and kind of you don't realize it because it's coming on so slowly. But I've had patients come in and they say, yeah, we start checking their joint mobility and they go, oh yeah, I guess I can't move as well as I used to. And so we can treat it and usually it gets better.
And I'm curious because Libby was diagnosed with chronic GvHD, almost 16 years ago this year. How have medical advancements improved the management and treatment of chronic GvHD?
Well, the biggest advancements right now have been in prevention of getting chronic GvHD in the first place. And that obviously is fantastic. So we've now got some new approaches using antibodies. So we're getting better at preventing it, but we still have it. And so I would say the current frequency of chronic GvHD in adults is around 30% still happening chronic GvHD. It used to be as high as 60%. In children, it's now around 15 to 20%. But we still, when it comes to the diagnosis and treatment, it's clear that early diagnosis is important because if we come in with immune suppressing drugs early, we have a better chance of reversing it. And there are now a number of newly approved drugs in chronic GvHD that we're using. One of the other things I'm hoping we're going to get better at is what are the best combinations of drugs. This is also something we don't know. And so these are some of the research that we're trying to do as well.
What are some of the potential side effects of undergoing drug treatment for GvHD?
Each of the drugs has their own little side effects. But the interesting thing about chronic graft versus host disease, when it's going on, not only is it a reaction against your tissues, but it also causes dysregulation. Your immune system actually doesn't respond normally. And so there's already an increased risk of infections. And in particular, it can affect how well your spleen works. And so people that don't have a normal spleen actually are very susceptible to certain types of bacterial infections, things called pneumococcus and Neisseria meningitidis. Anyway, there's certain types of bacteria. And I've had patients get rapid infections, getting sick within hours if they have that splenic dysfunction with the chronic GvHD.
For anyone living with GvHD post stem cell transplant, what can they do to be more proactive about their health and improve their quality of life?
When it comes to some of the manifestations of chronic GvHD, and I'm going to focus on a couple of them. One of them is what we call fasciitis. Fasciitis involves the tendons. And when it involves the tendons, it can lead to an inability to extend your fingers or your wrists or your elbows or your knees or your ankles. And so when we give immune suppressing drugs, they're not the only part of that. We also need good, moderately aggressive physiotherapy to work on the joints at the same time. And so that's, as an example, it's always kind of combined. When it comes to eyes, we can use immune suppressing drugs, but there are also local things that are used on the eyes. And this is one of the really common ones that a lot of people will suffer with is dry eyes. And there are some very good topical approaches. One of them we use actually is taking blood from the person and taking out the plasma and making them into eye drops. And plasma eye drops actually work quite well as an example. And the same sort of thing as somebody has a GvHD in the vaginal area. There are very good topical areas to treat that and ensure that somebody might have a healthy sex life. So talk to healthcare providers about that. When it comes to psychosocial support, most of the transplant centers should be able to offer that to you. It is very common for people to become depressed, to feel that it's hard to get back into working again. And so you can access those types of resources through usually the transplant centers that you went to if you talk to them, or sometimes your local physicians as well can get you into that. But I would say that a lot of people do need a lot of support around whether they're, and sometimes it's drugs, but a lot of times it might just be counseling for depression, anxiety. And when it comes to fatigue, all I can say is this: getting their GvHD treated, hopefully with time, that fatigue can get better. A lot of people with chronic GvHD feel like they're the only person in the world with what they have. So I do just encourage that you are not the only one and that you can be networked with other people through social work at your transplant center, through your own doctor, or through Leukemia and Lymphoma Society of Canada, or through the CTTC.
Through every phase of her cancer and living with chronic GvHD, Libby found ways to adapt to what she describes as her new normal. So, as you reflect on your last 2 decades of dealing with GvHD, what advice would you give to others who are dealing with it?
Well, GvHD really is the bane of a transplant patient, particularly when you consider early on when we have, survived the rigorous treatment of having a stem cell transplant. And then we have to deal with symptoms of GvHD. And I think for some people, it really can be discouraging. It's like, oh, I've come this far and now I have to deal with all of this. So I mean, we've mentioned this before, but it is important to be monitored by your physician. I don't know that there's a one-size-fits-all response to how do you cope with GvHD, but I can talk about some of the coping strategies I've used. So similar to when I was actually in hospital getting treatment, I still rely on some of the same things I did then. So I like meditation. I do still use, on days that I need it, healing imagery. I will say that being able to speak to somebody else who has had GvHD or currently has GvHD can be helpful. Confiding in a close friend. If you're really struggling, speaking to a counselor or a therapist to help design coping strategies that fit who you are as a person can be very helpful. So those are some of the strategies that I use. I also, while it may sound like an odd thing to describe as a coping strategy, but I find that giving back in the form of volunteering for the Leukemia and Lymphoma Society does help distract me from some of my limitations and also adds meaning to my life.
How important has support from other people been in your experience so far? And do you think it's had an impact on your recovery?
I would say that social support really has been indispensable in terms of my recovery. If you think about it, there's nothing like having somebody in your life who can tolerate it when you're vulnerable. That's a very powerful experience. Those moments when you can't conjure up hope, but they can hold the hope for you so that it's sitting there waiting for you when you're able to take it back. Who without asking will make sure that your child is fed, right? These are things that are hard to put into words, but that are truly vital in terms of support. And yes, for me, at a time many years ago now, pre-transplant, when I was feeling quite hopeless, the Leukemia and Lymphoma First Connection program connected me with 3 different people, and I have to say, there is nothing as hope-inspiring and as validating as speaking to somebody who has walked a path similar to the one you find yourself on. It's like it feels miraculous. And that gave me the kind of hope, just knowing that there was somebody alive in the world who had survived. It was a particular kind of wisdom and validation.
And in light of that, then, as you reflect on your last 16 years, what are some of the lessons that have emerged in your experience with blood cancer?
I'm not sure that I really appreciate all the lessons that I've learned, but I do know that they have been significant. So, for example, I am somebody who is much better able, not always, but much better able to live in the present rather than worry about an unknown, uncertain future or rehash the past, right? And that makes living much easier. An important lesson was learning to stop striving for my life to return to so-called normal, but rather to embrace sculpting a new normal, and in some important ways, a new me. Another thing that took me by surprise was learning, not always again, but oftentimes when I get very, very frightened, to transform the feeling of fear into moments of generosity and, which may sound odd, but also being grateful for the blessings that already exist in my life. It's a very powerful strategy and it's very healing. So those are some of the things that I've learned, I would say. I should just add that when I say all of these things, I recognize that I don't think any of us as human beings can stay hopeful and optimistic and grateful and all the time. That's not what I'm talking about. But I'm talking about it as being sort of more the default setting on your computer rather than the rarity, right? So it's more like that. It's like a striving for. And the more you're aware of it and the more you strive for it, the more frequently you'll experience it.
Libby's involvement with the First Connection program has allowed her to give back and support others facing similar challenges. As she looks forward, she continues to embrace life with a renewed sense of gratitude. Now, she celebrates her rebirth day each year on November 27th, the day she received her stem cell transplant.
Particularly since I was ill, I am a big believer in celebration. So yes, I do mark every anniversary of my stem cell transplant, and that usually involves going out to a favorite restaurant and having a dessert, yes, with a birthday candle. That's very important. So in that sense, I'm a lucky person because I get 2 birthdays a year, one the day I was born and one the day I was reborn. In fact, the restaurant for my 16th rebirthday coming up this fall has already been booked.
Libby's experience, though marked by constant challenges, reflects the ongoing reality of living with GvHD, where community support, medical interventions, and personal coping strategies play crucial roles in managing day-to-day life. I want to thank Libby for sharing her story and Dr. Schultz for providing his invaluable expertise. If today's episode has sparked any questions or concerns about your own health, or if you know someone navigating a similar path, there are resources available. The Leukemia and Lymphoma Society of Canada is a great place to start. Thank you for listening. For more information, please visit bloodcancers.ca. This podcast was possible with support from Sanofi. Thank you for your contribution to helping us understand the blood cancer experience.